I am Catherine Finan, and this is a little bit of information on SARS and COVID-19. So what is SARS? SARS is severe acute respiratory syndrome. It was first recorded in 2003 in Asia, and it spread from Asia to North America, South America, and Europe. But it was contained in 2004, and there hadn't been any cases since 2004. SARS is caused by a coronavirus, and symptoms include high fever, headache, body aches, diarrhea, dry cough, and pneumonia. There are some similarities of the SARS outbreak in 2003 to the current pandemic. Our current pandemic is caused by SARS-CoV-2, our coronavirus, or COVID-19. They have similar transmission by air droplets. They both can cause pneumonia. They both can be mild or severe cases, and they're both caused by coronaviruses. So COVID-19 and the current pandemic, it started in Wuhan, China in December 2019. The virus was obtained from a wild animal, probably a bat, and we noticed it by an outbreak of pneumonia in Wuhan. It then spread throughout the world to the United States January 20th, 2020. It was declared a pandemic March 11th, 2020, and the R0 is about 2.5. So for every one person that gets COVID-19, they will infect 2.5 more other people. So the structure of the coronavirus, as you can see, there's a picture of the coronavirus, the SARS-CoV-2 under a microscope. So the coronavirus, corona means crown, and you can see there's a little crown of spike proteins. The spike proteins attach to the ACE2 receptors on our cells in our respiratory system, upper and lower respiratory system. The cells then fuse, and the coronavirus pushes its viral RNA into our cells, and the RNA is coded to make more proteins that make more virus cells. So who is most susceptible? Well, everyone is susceptible, but it's most common in older people in senior living communities or rehab facilities, people with underlying medical conditions such as cancer, obesity, people who are immunosuppressed, and other people like that can also get it quite easily. Just to know that having coronavirus once does not mean that you will not get it again. So the death rate across the world of coronavirus, it's low, but it does have a lot of people dying. So America has one of the highest infection rates, but we don't have the highest death rate. This is a graph of deaths per 100,000 people in each country. Brazil has the highest on this graph, and Vietnam on this graph has the lowest. Brazil having 264.6 deaths per 100,000, and Vietnam having 2.15 deaths per 100,000. The United States is in the higher aspect with 187.15 deaths per 100,000. So why is the coronavirus so special? Back in 2020, we thought it was just going to be a flu or a cold. It would not hurt us very badly. Well, the flu is caused by influenza A or influenza B, and the symptoms appear 1 to 4 days after exposure. COVID-19 is a different kind of virus. It's SARS-CoV-2, and the symptoms appear 2 to 14 days after exposure. So with the flu, you usually know when to stay home sick because your symptoms are there right after you've been infected. But for COVID-19, your symptoms may not arise for a long time, which makes it easier to give it to other people. There's a higher mortality rate in COVID-19 than the flu. It's more contagious. You can lose your taste or smell for weeks to months afterwards, and there are some long-lasting effects that may occur for some people with lung issues, lung damage, organ damage. And here is some infection information from diagnosis to symptoms to treatments. So there are a couple of kinds of diagnostic tests. If you're trying to find your current infection status, you can get a PCR test or antigen test. For past infections, seeing if you have been infected with COVID-19, you can do antibody tests. So current infection tests include antigen tests and polymerase chain reaction PCR tests. The antigen test is fast but can be inaccurate. It's cheap to make, but it is up to 20% inaccurate. Not everyone has antigens in the beginning of the infection, and that leads to inaccuracy. The PCR test, however, is very sensitive in detection. You only need a couple of cells for it to know that you have coronavirus. You can get the results in hours, and a good PCR test can be 100% accurate, but it depends on the kind of PCR test you get, if it's a good one, if it's a bad one. It depends on that to be its accuracy. So how does that test occur? There is a nasopharyngeal swab that is entered into your nose to the area between your nose and your throat. It does not touch your brain, no matter how much it feels like it. And the swab is rotated around for 15 seconds in each nostril to make sure that it picks up enough of the germs or bacteria. To see if you have had coronavirus, you can do an antibody test. Antibodies show that your body has fought off the infection. This can tell you if you've had coronavirus, COVID-19, but it can also tell you if your vaccine has worked properly. So some signs and symptoms, they appear within 2 to 14 days after exposure. That means that you might not know that you are sick or infected until a while after you get infected. So some symptoms include fever, cough, difficulty breathing, fatigue. Your muscles might ache, you might get a headache, you could have some loss or taste or smell, which not everyone gets, but a lot of people get that. It's the distinguishing aspect. You will probably get a sore throat and some congestion. So the infection is coming to an end. What do you do? So the quarantine is when you may have been exposed. So all of us for the past year have been quarantining because most of us aren't currently infected, but we're making sure that we don't get infected. Isolation is when you currently have the virus and you're staying away from other people. So when you are infected with the virus, you have a 10-day isolation starting the day that your symptoms appear. You have to do that 10-day isolation and 24 hours without a fever. You can't use a fever reducer. It has to be naturally 24 hours without a fever. And your other symptoms need to start improving. These other symptoms improving do not include your taste and smell that have been removed. That may be gone for months, and it doesn't mean that you're infected for months, but they take a long time to come back in some cases. So treatments for this, because it is a virus, there is no cure. It's not a bacterial infection, it's a viral infection. For some ways to make yourself feel less bad, you can take a fever reducer like ibuprofen. You can stay hydrated, electrolytes, water, Gatorade. You need to rest. And if your symptoms get severe, like you are turning blue, you feel pain in your chest, you may need to go to the hospital. So mild cases, as you can see, cough, fever, and fatigue. Fever, cough, loss of taste or smell, chills, fatigue. You can take fever reducer, drink water, rest, everything in the last slide. But there's no need to go to the hospital. And for severe cases, as you can see, hospitalization might be required. If you're having trouble breathing, chest pain or pressure, confusion, severe fatigue, blue lips, skin, or graying nails, that is the time to go to the hospital. Hospitalization, they can give you antivirals. They can treat any complications like failing organs due to lack of oxygen. They can give you oxygen. Some places are using plasma to help boost the immune system. And at some times you might need to go to the ICU so they can put a tube down your throat to breathe for you if you are unable to breathe. So what can we do to prevent the spread of COVID-19? Well, we need to distance, we need to wear masks, we need to wash our hands, and we need to get vaccinated. So distancing, you need to stay 6 feet away inside of buildings from sick people and 6 feet away outside from other people of other households. And in general, avoid crowds. You never know if someone will be sick or not. So masks are very important. As of August 4th, 2021, in Illinois, masks are required in all indoor areas, such as schools this fall, grocery stores, no matter of your vaccination status. This is due to variants such as the Delta variant. They are spreading even through vaccinated communities. Of course, it's not as dangerous, it's not as deadly, but you don't know who you're going to spread it to. So masks are not required outside unless you are in a crowd, like people have been seeing the crowds of Lollapalooza, which it looks like an infection waiting to happen. So masks keep our germs from flying through the air to other people and other surfaces that we might touch. Hand washing is very important. We need to wash our hands for at least 20 seconds in warm water. After touching any surfaces, after going in public, touching your face, going to the bathroom, before you make food, anything like that. Anything that you touch, you need to wash your hands. If you cannot wash your hands, you can use hand sanitizer that has at least 60% alcohol. And making sure that we clean and disinfect high-touch surfaces is incredibly important because when we touch them, of course, we go and wash our hands, but those surfaces are going to remain dirty and they're going to have bacteria and viruses on them. So vaccination, this is how an mRNA COVID-19 vaccination works. So the COVID-19 has the spike proteins, and the spike proteins latch on to the ACE2 and push the RNA from COVID-19 into our cells, and that makes more COVID-19 virus cells that then go infect more areas. So mRNA is the genetic material that helps to give your body what it needs to know to make proteins. So the vaccine has mRNA, and this mRNA in the vaccine tells our body what is in the COVID-19 virus. It tells us about the spike proteins, it tells us anything that COVID-19 would tell us, and our body is able to make the T cells and lymphocytes that will attack the RNA from the virus, and then our bodies know how to fight it if we end up getting COVID-19. So who can get the vaccine? So Pfizer has ages 12 and plus. while Johnson & Johnson and Moderna are 18 and plus. The vaccine came out in a rollout of phases, phase 1A being healthcare personnel and like senior living communities, and then so on, with less and less of an essential status. So in these vaccinations, we need to know that some people may have allergic reactions. It is not common, but they may occur. So there are some debates on the vaccine, both realistic and very unrealistic issues with the vaccine. So realistic issues might include the allergic reactions that I just talked about. You can get hives, swelling, or wheezing that may keep you from getting a second shot. You are not supposed to get the second shot if you have that bad of a reaction. A rash on the area of vaccine, you can still get the second dose. That is known as the COVID arm. It's just your body attacking COVID. If you have an anaphylactic reaction, you need to not get the second dose because you could die. People are monitored for 15 to 30 minutes after being vaccinated to combat people getting horribly injured or killed because of an allergic reaction. So some unrealistic issues include politicians and anti-vaxxers being against the vaccine. So politicians have been spreading disinformation in the early pandemic, even if they've come along now. The pandemic has been around for a year and a half, so there has been a long time for disinformation to spread. The vaccine was pushed out quickly, which some people think is meaning that it's going to be dangerous or it's not tested well, even though things have been fine thus far. Many people are skeptical of the vaccine and don't want to be lab rats. They don't want to be the test subjects. But in the end, we know how this vaccine works and we know how it's supposed to help people, and that is the most important aspect, is keeping people safe. So some other unrealistic issues involve the conspiracies. So there, a few months ago, was a conspiracy about the vaccines making us magnetic. And as you can see in this picture is a woman at a town hall meeting sticking a key to herself because we are magnetic. This was completely taken out of control and disproven so many times because our skins have oils on them. That's why you can stick metal things to them, because the metal latches onto the oil and it just sticks to our skin. It does not make us magnetic. But some people also say that there's microchips in the vaccine, which, of course, I have always said you carry a phone in your pocket. If you think that the government is going to track you through a vaccine, then maybe get rid of your cell phone. But anyway, the microchips just couldn't happen. Microchips are too big to be in a vaccine injected through the skin. So another unrealistic issue is everyone's lack of belief in science. So social media, Facebook, Twitter, WhatsApp, there have been a lot of people spreading vaccine disinformation. The quote unquote Karens that go on Facebook and start talking about all of these crazy conspiracy theories and why the vaccine doesn't work and why we should use essential oils instead of the vaccine. So also, the changes in guidelines in the beginning of the pandemic led to confusion, which is understandable, but we all need to remember that science is not exact. Science is always changing for the better. So when we get a different guideline, we need to understand that it's not like the past guideline was wrong or flawed. It's just we did not have the information that we do now. which is a hard concept for some people to understand. So some misinformation about COVID-19 on the origins, treatments, prevention, and, of course, more politics. So the quote-unquote real origin of COVID-19, some people believe that it was a lab leak to control population. This has not been proven wrong, but it is very highly unlikely. Of course, we do want to get to the bottom of it and see how exactly the COVID-19 pandemic started, but it was probably not a lab leak to kill people. And of course, because the coronavirus spread from China, there has been xenophobia towards Asians, and this past year we have seen the hashtag Stop Asian Hate, which is because many white supremacists or people who are just xenophobic have been hurting Asian people because of this pandemic, even though it's not all of China's fault, because we haven't been doing much to help the pandemic either. So there are also some false treatments, like injecting bleach, which our former president did say, and then he took back as it was a quote-unquote joke. There have been people that drank rubbing alcohol because they thought that it would disinfect them from the inside out. Our former president, Donald Trump, said that people should take hydroxychloroquine because it would treat the COVID-19 in our body. But hydroxychloroquine is used for lupus and malaria and arthritis, so people do need hydroxychloroquine. So when people went to get hydroxychloroquine for the coronavirus, a lot of people who desperately needed this for lupus and malaria and arthritis were not able to get it, and hydroxychloroquine does not work that well on the coronavirus. So there are quote-unquote prevention that conspiracy theorists talk about, such as COVID doesn't even exist. It's a government myth made to control us. An idea that masks actually give us COVID because of our inner COVID, and breathing it in will give us more COVID, which does not make any sense. But also that masks will kill us because we're breathing in our own CO2, which, of course, there is the comeback of doctors stand in a surgery room for hours and hours, so why aren't they all dead if that is going to give them CO2 poisoning or something? Also, a lot of people talk about herd immunity. So there is a misunderstanding of what people think it is and what it actually is. People believe that if everyone gets coronavirus, then no one else can get coronavirus. But herd immunity is actually about how vaccines can help, because if there are enough people who are immune to the virus, then it cannot spread any further. So politics, again, I really hate to get so political, but for some reason, this topic is very political. So why is this political? There's a divide in the United States about how far the government should reach. So should the government be able to tell people that they are required to wear masks, or does that go against our freedoms? So there is this divide on if masks go against freedom, if making everyone get vaccinated goes against our freedoms. There's also people talking about how this is fascist, but they don't really understand what fascism really is. So is fascism in this case having the government tell us we need to get vaccinated? No, but that's what people believe. There's also QAnon, which is a very large conspiracy theory that is going through the government as well. which is strange, but it's spreading COVID disinformation, white supremacy, and in the end, why is Florida so against masks? Florida and many other states in the South are against masks as it tramps on our freedom. It will keep the government in control, but in the end, it is all about keeping people safe. So, um, wearing masks is a very important thing to do. Distancing is very important. We do not need to open up until we can make sure that people are safe. Is there a need for freedom if people are going to die at the hands of that? In Illinois, we now have another mask mandate where we have to wear masks inside, while other states are doing the exact opposite, making sure that people don't have to wear masks. They're not required to wear masks. So what can I do to help? What can you do to help? We just need to follow the guidelines and roll with the punches at this point. This is a constantly changing virus. It has been since March 2020. We just need to deal with everything as it comes to us. We need to wash our hands. We need to wear a mask in public, in crowds. We need to clean constantly, clean our high-touch surfaces so we don't get other people sick. We need to distance from others, stay away from crowds again, wear your masks in public, don't get too close to people. And one big thing is to stay home if you are sick. If you can stay home, you need to stay home because you will infect other people, and some other people cannot survive an infection. The immunosuppressed, the people with family that are immunosuppressed. So making sure that you don't spread the infection to anyone else is incredibly important because you don't know who they're going to spread it to. If it has an R naught of 2.5, like I said earlier, and you go out, you might infect 2.5 more people, and they will infect 2.5 more people after that. So it's important to stop the spread as soon as possible.